I do my best to read all of them. 20 minutes is allotted for the question and answer section. For the evidence of attendance, we take some screenshots. Passing score is 70, everybody knows. If you do not receive any second post link from the SPC members, means you already passed the examination. The certificate will be distributed after the 4 sections. Today's topic is, as I said, heat-related emergencies. The presenter is going to discuss define heat-related emergencies, pathophysiology, risk factors, general signs and symptoms of heat-related emergencies, and pre-hospital management. Today, our speaker is my colleague, Mr. Minsky Conception. He is working for Qatar Energy ambulance nurse. He's more than 15 years experience in the pre-hospital, and who is a registered nurse as well. He's worked before with the pre-hospital and hospital in the Philippines and Qatar also previously. It is my pleasure to welcome Mr. Minsky for today's presentation. Mr. Minsky, please welcome. Mr. Minsky, you can share your slide. Yeah. Okay. Go ahead.
Mr. Minsky still this one mute. You can unmute.
Minsky, unmute your mic. Hello, Minsky.
Okay now, CG. Okay now, somebody unmuted me.
Okay. Go ahead.
All right. Okay.
Yeah.
Well, before we proceed to the presentation, I think it's proper that we need to acknowledge and thank the Qatar Energy Scientific Committee for this CPD activity, and especially the Qatar Energy ambulance nurses from Raslafan, Dukan, and Ms. Said, under the leadership and chairmanship of Mr. Jainal Tanaria. Okay, before we, I don't have any actual or potential conflict of interest in relation to this presentation. Okay. The topic that I'm going to discuss today is about heat-related emergencies. The weather is very timely for today because the weather in Qatar is, as we have summer here, and hot and humid temperature is started since last month. Now the weather here is not only unpleasant but can also get very dangerous if precautions are not taken, and one can get affected to heat illness, which can lead to one of the health emergencies that I'm going to discuss today. The learning objectives that we're going to do is, after attending the sessions, the participants will be able to define what is heat-related emergencies, describe the pathophysiology of heat-related emergencies, explain the risk factors predisposing persons to heat-related emergencies, to list the general signs and symptoms of heat-related emergencies, and to explain the pre-hospital management of heat-related emergencies. Case scenario. Okay, on a hot summer day with relative humidity outside, EMS were dispatched to a shutdown area where a person suddenly collapsed. Upon arrival, responders found a 40-year-old male laying on the ground with GS score of 12, blood pressure 185/81 millimeters of mercury, pulse of 104 beats per minute, respiratory rate of 16, pulse oximetry of 98 on room air and the temperature of 41 degrees centigrade by tympanic temperature. You notice that the skin is red and doesn't to be perspiring. Now, we're trying to answer here. It's what is your assessment of the above scenario of the given signs and symptoms there? What is your primary aim or goal in managing this patient? And how do you manage this patient? All right. Now, stats and figures. Heat is a leading weather-related killer in the U.S. That is more combined with the other natural resources they have, like tornadoes, lightnings, sort of like that. And then, according to the Lancet Planetary Health, they have predicted that around 123 persons out of 100,000 in the MENA region will die yearly from heat-related causes by 2100s. In Saudi Arabia, the incidence of heat stroke rises considerably, seasonally from 22 to 250 cases per 100 population. Now, in Gulf region, in Qatar Peninsula, temperature may exceed 45 degrees with 90% humidity, which varies each day. Okay, heat-related illnesses. As I mentioned earlier, these are the heat-related emergencies are grouped under the name hypothermia. By definition, hypothermia or health illness is a condition resulting from exposure to high heat, extreme heat, where the body becomes unable to properly cool, resulting in rapid rise in body temperature. Now, if not alleviated, patient will have heat-related illness resulting heat cramps to the more serious heat illness, heat stroke. Hypothermia is defined as is a temperature above 37.5 degrees centigrade. Now, how do we generate heat and how our body can have?
Mr. Minsky,
Yes.
can I interrupt you for a while?
Yeah, no problem.
All participants, please check your chat box. We put on question and answer. We appreciate everybody to please answer your question. Please answer the question. The question is, what causes heat illness? Please check your chat box. Yeah. Very good. Yeah. Oh, good. Good response. Good. Yeah. Okay. Dominsky,
Yes.
what is answer? Most of them are answered. Question
Well,
answer D.
yes. What causes heat illnesses? The answer is letter D, all of it.
All of them. Okay. Okay.
Okay.
Please continue.
Oh, now generation of body heat. There are two types. We can generate heat through metabolic heat and environmental heat. Metabolic heat defined as the heat generated through digestion of food, the work we do, or the exercises we do, either inside the house or outside the environment. Then we have environmental heat. It is absorbed from the surrounding environment, like the air temperature, the ambient, the solar radiation, the humidity of the environment. Now, thermoregulation. It's the process that helps your body to keep a healthy, normal temperature. And all the normal thermoregulation mechanism is to return your body to a state of equilibrium of normal body temperature. Normal body temperature will range from 36.5 to 37.5 according to other sources, but the temperature that our body needs for optimal condition for cellular reactions in the human body to occur is 37 degrees centigrade. Now, an increase in 1 degree centigrade increases in core body heat. It triggers the hypothalamic thermoregulation. Now, look at here on the slides that we have here. Okay. The thermoregulation, if the if the heat generated by your body through exercise or through strenuous activity or through metabolic heat, through strenuous activity or exercise is more than the rate of heat leaving.
पूरी बाजी बोला है ना यार, कितना टाइम हो गया देखो जल्दी।
Come again.
Please mute your mic, participants. Okay, Minsky, go ahead.
Okay.
You can continue.
This
All right.
Thursday.
When the body is involved into stress, heat stress, the thermoreceptors in the visceral organs in the skin will transmit information to the sympathetic nervous system of the brain called the hypothalamus, which in return directs messages for the increase of perspiration on the skin and increase vasodilation, and to support vasodilation is to increase the heart rate. The combination of skin perspiration and evaporation and increasing the blood vessel next to the skin will result in the normalization of body core temperature of the human body temperature of to 37 degrees centigrade. Now, on the right side here, here's a picture of continuous gas exchange. Now, when the hypothalamus will direct the increased cardiac output to the peripheral vasculatures, it increases about 30% of the cardiac output. And what it does here is that the warm body from the visceral organs or the parenteral organs will be shunt down towards the surface of the skin. Now, as you can see, from the surface of the skin, the temperature will transfer from the blood vessels to the skin, and heat loss will occur through convection and evaporation. And the cooler temperature will be transferred to the blood and go back to the visceral organs of the body. Now, mechanism of heat loss, we have 4 basic types of heat loss. We have convection, conduction, radiation, and evaporation. Convection here is an example is that when you go to a room and there's a cool air like air conditioning, the air conditioning wind, the cool air will pass through your skin, and by that the heat from your body will be transferred or divested. Conduction is that another example if you are sleeping or sitting in a cold surface area. Radiation, example is when you enter a room and the temperature inside that room is much cooler than the outside environment, you will radiate the heat from your body towards that to the room itself. And evaporation, this is what we have is the sweating mechanism and evaporation. And through evaporation, it's we have a 1.5 liters per hour of daily fluid loss through sweating, and this would increase to 2 to 3 liters per hour if we're doing strenuous exercises in a brief period of time. Okay, how does stress occurs to our body? Okay, when air temperature is the same or warmer than the temperature, body temperature, cooling the body is more difficult. Like when the humidity becomes higher, perspiration will not evaporate as quickly, preventing the body from releasing heat as fast as normally would, causing various levels of heat stress. Now, predisposing factors that would predispose an individual to heat-related illnesses. We have climate, a hot temperature, high humidity, for an example of that. Then exercise and strenuous activity. Okay. Age, the very young and the elderly, because they will not be unable to adjust quickly to their environment or thermoregulate themselves from the environment. Pre-existing illnesses like cardiovascular disease, peripheral vascular disorder, kidney disease, diabetes, skin diseases, and thyroid gland diseases as well. And of course, dehydration, alcoholism, fever, obesity, fatigue, and malnutrition. Drugs could also hamper sweating and increase in heat production. And that's one example of this: cocaine, barbiturates, alcohol, amphetamines, antihistamines, diuretics, alpha-adrenergics, medications like for high blood pressure as well, and lack of acclimatization, because if you'll not be able to tolerate heat, then you will succumb to heat-related illnesses. Now, it takes about a week or so for your body of repeated heat tolerance for you to get acclimatized. Now, prevention of heat-related illnesses: drink plenty of fluids, take frequent breaks if you're working outside in the environment, or try to work in a cooler hours of the days. Wear proper clothing, loose-fitting, lightweight, light-colored fabrics are recommended. As we said earlier, acclimatize, stay in shape, because people have good heart and good muscle tone will generate heat less. Be aware of special health risks like caffeine or taking alcohol, diabetic, or medications for high blood pressure and allergies can increase risk of heat stress, and work in pairs, especially if you're working outside in a hot and humid environment. Okay, heat-related energy. We have pathophysiology of heat-related energy here. Emergency. Now, as we said earlier, the external and internal heat load causes stress to the body. Now, our body will respond with thermoregulation. I'll discuss it later, and the behavioral response. In behavioral response, the person will go out of the heat environment and seek some cool areas. Now, in thermoregulation, as we said earlier, there will be an increase in cutaneous vasodilation towards the peripheral circulation, and there will be an increase in thermal sweating, where there will be evaporation. And the combination of all of this will return the core temperature, normal body temperature, to normal. Now, if all the thermoregulation is successful, it will result to the heat tolerance of a person. Now, in a repeated chronic heat exposure, the heat tolerance develops and leads to heat acclimation. Now, when thermoregulation is inefficient, when thermoregulation inefficient, heat illness develops with varying set and signs symptoms of heat syncope, like heat syncope and heat stroke. Now, the activation of thermoregulatory functions will also have an effect on the autonomic effectors, like the regulators of the homeostatic system. Okay. Now, you know that will be the, continuous vasodilation. Now, the continuous vasodilation will have an effect of the decreased tone and reduced ventricle filling, which in orthostatic position may lead to low brain perfusion and heat syncope. Now, electrolyte imbalance through intense sweating and evaporation, there will be some form of electrolyte imbalance and the loss of salt and water. This will, in tune, if not replaced with fluid, will develop heat cramps to a person. Okay, this will usually result in people who are exercising. Now, in severe dehydration, severe hypovolemia, there will be too much loss of fluid in the system. There will be too much loss of fluid and salt in the system. Okay, the losses of too much fluid, salt and fluid in the system caused by strenuous exercise in high heat environment will lead the person for heat exhaustion. So that will result to dehydration and hyponatremia. Now, again, in continuous vasodilation and corresponding increase in cardiac output, there will be cardiac output to support the peripheral vasodilation. There will also a relative reduction of intravascular volume, which in turn causes vascular volume, which in turn causes the reduction in peripheral perfusion, resulting in multi-organ collapse or failure. Now, because there is already high dehydration, the heat activity, the thermal regulations are already overwhelmed. Because it's already overwhelmed, it stops the increase in vasodilation and evaporation. It will lead to progressive hyperthermia. The progressive hyperthermia inside the body and will lead to heat stroke. So that's the pathophysiology of the heat-related emergency. One of the related emergencies I'm going to discuss today is about heat cramps. Heat cramps results from losing too much salts and electrolytes using profuse sweating and excessive water intake. Now, usually heat cramps will affect the muscles in the abdomen and in the legs and the arms. Now, this is a least serious form of heat-related emergency. Signs and symptoms would be severe muscle spasm, pain in the legs, arms, and abdomen, weakness, fatigue, possible nausea, normal slightly elevated heartbeat. We have cold, moist skin. Patient will be thirsty. Core temperature remains normal or normal BP. Now, management is just symptomatic. He could have, patient could have rest. You can oral fluid to the patient for electrolyte replacement, and you can simply apply firm pressure or massage the affected muscle area. Next is heat exhaustion. Heat exhaustion results when, as I said earlier, is the excessive loss of water and excessive loss of salts in the body through strenuous exercise in hot and humid environments. The amount of water lost in perspiration exceeds water intake. And if there's no fluid being replaced, then patient will develop heat exhaustion. Core body temperature of persons having heat exhaustion will be 38 degrees centigrade to 40 degrees centigrade. Signs and symptoms would be headache, lightheadedness, dizziness, or fainting. We have moist, pale, and normal cool skin. There will be heavy sweating or weakness, normal to low blood pressure, rapid shallow breathing, and rapid weak pulse. There will be nausea and vomiting, heat cramps or muscle spasm, and sometimes they'll have loss of consciousness, but usually it's just brief. Now, heat stroke.
Mr. Minsky,
Yes.
can you interrupt
CJ.
for a while? Okay, we have a one question answer section. I request all participants to please check your chat box. We raise a question. I encourage everybody to please answer the question. The question is, which of the following is not common symptom of heat exhaustion? Okay. Yeah, go ahead. Yes. You're expecting more participation? Right or wrong, please, you can answer. Oh. We are getting good response. Please go ahead. Most of them are answering. The answer, most of them are answered. The answer is G. Is it right, Mr. Minsky?
For heat exhaustion.
Yeah.
The answer will be here dry mouth. Sometimes with heat exhaustion, people will have diarrhea also, because there's a decreased circulation to the visceral organs like the abdominal area, and that causes problems in the abdominal area also. All right, CG?
What is the answer?
Dry mouth.
Dry mouth. Okay.
What do you think, CG?
Most of them are answered diarrhea.
We'll just find out later. Okay. Next of the heat-related illness, which is the life-threatening and the true medical emergency, is heat stroke. In heat stroke, the central nervous system fails. The body loses the ability to regulate the temperature. The ability to sweat is lost. And when the heat regulatory system is overwhelmed, the body temperature rises rapidly. And that would cause heat stroke. And not just that, when the body rises rapidly, it would cause other problems in the system that would develop into systemic intravascular inflammation. Now, signs and symptoms would be body temperature above 40 degrees and general body weakness. You have mental confusion, acting strangely or slurring of speech, possible unconsciousness and convulsion, hot, dry skin or hot and moist skin. Now, hot, dry skin, if it's it's in a very late symptoms already. Patient may have moist skin, and then we have a rapid shallow breathing, rapid strong falls, vomiting, and potential seizures. Now, I want you to indulge me here, guys. Between heat stroke and heat exhaustion, I want you, if you can remember something that what I have said earlier. Let's say, for example, in the temperature, can you write in the chat box of what temperature that we will see in patient of heat stroke, or the temperature that we will see in heat exhaustion? So you may answer now. So all right. CG had the
Yeah.
answer. Okay.
Yeah. Some
Okay.
of them answered.
Let's see
You
if
can
you
answer.
answer. Let's see if you answer this.
Participants, please answer in the chat box. We are getting mixed answers. Yeah, go ahead. If it is right or wrong, please write down.
Okay. As discussed
Someone
earlier.
miswrote.
Okay.
Yeah.
Heat stroke, any temperature that's above 40 degrees centigrade, we consider it heat stroke. Well, heat exhaustion is below 40, 39.9 to 38 degrees centigrade, or 40 or above 40, okay, 40 to 38 and 40. And not just about that. You have to note also that even though if you assess, you take care of a person and assess him to have a temperature of 38 or 40, however, his mental status, the patient's mental status is confused, or his level of consciousness is down, then you have to take into consideration that this person is suffering from heat stroke, not heat exhaustion. Now, how about the skin of the patient of having heat stroke and heat exhaustion? What do you think the patient have? Okay, you may answer now before I'm going to show the answer for you.
Skin. Okay. The question is skin. Participants, please answer. We are getting dry, hot, warm and hot and dry, moist. Some of them are answered. Participant, please answer your question. Please answer. They are answering dry and hot. Dry and hot, pale, dry, mixed question. Mixed answers.
Sorry. Okay, the answer is for heat stroke, there'll be hot and dry red skin, and for heat exhaustion, cool clammy skin. All right. And how about for the level of consciousness of this patient? Or the pulse or level of consciousness? What do you think the patient has for heat stroke and heat exhaustion?
Participants, please. You can answer on chat box. Minsky is asking, what is the level of consciousness in the patient? Some of the answered, heart rate is decreased and decreased level of consciousness.
Okay, so let's see. All right, there you go. For the pulse, we have strong rapid pulse in the heat stroke or rapid weak pulse in the heat exhaustion. Or, however, this could be rapid and weak also in the late stage for heat stroke. The level of consciousness, we have mental confusion, slurring of speech, and unconsciousness in heat stroke, and light compared to lightheadedness, dizziness, or fainting in heat exhaustion. Now we have nausea and vomiting for both, and in heat stroke, sweating may stop, but in heat exhaustion, there will be heavy sweating. Yes. All right. Okay. This is the hypothermia algorithm or hypothermia algorithm. This is the 2020 guidelines of the European Resuscitation Council. Okay. Before I'm going to proceed, we're going to proceed here. We have to note this one, that when you're going to respond to the patient, okay, rapid recognition, rapid assessment, and rapid management is the key for the survival of the patient. Now, what you do first, you have the new approach now in patient with heat stroke. Okay, as before is we know cold water immersion. It is the golden standard in treating heat stroke, in lowering their blood pressure rapidly to less than 40 degrees centigrade. So most of the EMS pre-hospital approach now in the US and in other area is that they have the cold first, transfer to hospital after. What they're doing here is that they're going to immerse the patient in a cold water bath in scene. And then they'll try to rapidly cool the patient to less than 39 degrees centigrade. And they're doing this and taking their rectal core temperature. Now, I know this is difficult because sometimes it's difficult for us due to, it's very, especially if you're outside in the environment, although if you move the patient to a cool shaded area, but taking rectal temperature it's difficult to provide dignity in outside environment. And other EMS pre-hospital EMS companies in the industry were doing that, because we cannot provide bathtub because it's difficult to be carrying bathtub in the ambulance. What they do is that they will have a cooler, a cool box with ice and some jug of water. Now they will be using the body bags. Okay, they'll be using the body bags where they will put the patient inside. Now fill the body, put the patient inside, close it until the neck area. Before that one, they will be filling it with water up to 2 inches to the body and put some ice there, or they're going to put some ice water already or cold water already inside. Now, the only way that they're to do that, because they have the electronic rectal thermometer that they will be able to monitor the patients every 4 minutes. Now, when the temperature goes down to 40, that's the only time that they will transport the patient. And some reports that some of these EMS providers will be on this scene for 10 minutes, 15 minutes, and because they have to wait for the temperature to go down. All right, for the hypothermia, when you assess the patient, does it require any CPR? Or for patient with hypothermia, and when you assess them, for example, if you see them lying on the ground, does he need CPR? Okay, if you need CPR, then you go to the appropriate CPR universal algorithm. If not, you have to check for the core temperature of the patient. If the core temperature of the patient is more than 40 degrees, then you have to provide rapid cooling or water immersion if possible. Okay. Now, if the temperature is less than 40, less than or equal to 40 40.5 degrees centigrade, but the patient is confused or disoriented, still, you treat this patient at heat stroke, do rapid cooling and water immersion. And once you do that, as I said earlier, because there's a new trend right now, is that they will check the temperature of this patient to less than 39. Okay. And after checking if the temperature is less than 39 and there will be a resolution of the symptoms, and that's the only time that they will transport the patient to the nearest hospital. Now, if core temperature is not more than 40 degrees, or the person is not having any confusion or disorientation despite decreased blood core temperature of less than 40. First, they will take into account of what is the sodium level of the patient. Now, in the hospital, we can do this, but in the pre-hospital aspect, it is very limited as we don't have any chemistry analyzers on board. Now, they have an ISTAT for that, it will take a drop of blood, put in the cartridge and put in the machine, and it will read the blood sodium level and other electrolytes in the system. Now, if there is a decrease in blood sodium level, and there's an abnormal mental state, they will initiate 100 ml bolus of 3% saline at 10-minute intervals, and another second and third bolus only if it's required. We're not carrying normal 3% saline here, but we're carrying lactated ringers, 0.9 sodium chloride. Now, if it's severely dehydrated, if the patient blood pressure sodium level is normal or below 130, above 130, or severely dehydrated, this is the time that they will also administer lactated ringers or normal saline. So to support dehydration, and increase internal perfusion to the organs. Now, if the patient is also conscious, we can also provide oral fluids to this patient in sips only. Now, if it's not severely dehydrated, you have to check for any other symptoms. You have, and if not, then if you see other symptoms aside from heat exhaustion, heart-related illness, then you have to go to an appropriate algorithm. Maybe the patient is suffering from hypoglycemia or heart rate from behavioral problems, and so forth. And if symptoms are just mild, then you have to release with exercise restriction for this patient. Okay, that's all for the hypothermia algorithm portion. Pre-hospital risk assessment tool, J-Erato score. Okay, the J-Erato score the J-Erato score was developed in Japan sometime last year or 2 years ago. But right now they are using this pre-hospital vital signs in predicting the severity of heat-related illness. The 6 vital signs that you're going to take will have is respiratory rate, Glasgow Coma Scale, systolic blood pressure, heart rate, body temperature, and age. Now, this is a given of score of 1, 0 of 1. For respiratory rate, if rate is equal or more than 22 per minute, there will be score of 1. If less, then there will be score 0. And so forth with Glasgow Coma Scale. If it's less than 15, there'll be 1. For systolic blood pressure, it's less than or equal to 100 mmHg, that will be 1 also. Heart rate, if it's increased or not, increased to 100 beats per minute or equal, that will be 1. And body temperature, if it's more than 38 degrees centigrade, equal, equals 1. And age 65 years. 65 years old, that will be scored as 1 as well. Now, the J-Erato score was calculated based on the vitals at presentation on an assessment and on an early risk predictor of severity of heat-related illness. Now, the grading system, if the score of the patient is 1 to 4, then he's graded into low risk, and if it's high risk, that will be 5 to 6. So that's now assessment tool in assessing the patient and heat-related illness. This is basic in all other problems. You have to, before entering the scene, you have to do scene size up. Okay, you determine that the scene is safe. All right, the nature of the illness, then how many patients we have, if you need additional help, and consider spine stabilization of any. Then, as you approach the patient, you do the general impression of the patient, its level of consciousness, determine chief complaint and apparent life threats. They assess airway and breathing. You assess the circulation as well and identify priority treatment if a patient is a priority 1 patient or not. Now we'll provide the focus history and physical exam of this patient. Assessment tool for also to, if you find that the patient is having some environmental emergency, then you will just follow this kind of questions for this patient, like the source, the environment that he's in, the duration that he's exposed to the heat, or does he lose consciousness, or the effects is having unconsciousness or not, or if patients is suffering from altered mental status, it could happen to heat-related illness or patient with low blood sugar as well. To continue assessment tool, we have to find out for the allergies, the medications, past pertinent medical history, last oral intake, the events leading, vital signs of the patient, your intervention, and transport reversion and going assessment as you go along. Now, right now we'll do the management of patient with heat stroke and head exhaustion using the Qatar Energy guidelines for heat-related illnesses. Now, the purpose of this guideline is to focus on cooling the patient while at the same time maintaining perfusion and ventilation. Now, it's indicated for adult patient presenting with MALI and suspect hypothermia. Now, patients suspected to be experiencing heat exhaustion who have prolonged exposure to hot or humid environment and also have any of the following: evidence of dehydration or hypovolemia. It's either syncope, dizziness, generalized body weakness, and tachycardia, or patient with evidence of increased body temperature. It's either normal, slightly elevated, or is patient sweating. Also, if patients have suspected to be experiencing heat stroke with a temperature of 104 degrees Fahrenheit or 40 degrees centigrade or higher, and also experiencing altered mental status or seizure activity. Okay, heat exhaustion. Okay, patient with heat exhaustion, what we're going to do, we have to assess the patient and record the vital signs and the level of consciousness. Remove the patient to a cool environment and shaded area where the ambient temperature is cooler than the outside temperature. You have to consider oxygenation of this patient also. You have to provide 15 liters of oxygen if it's needed in the situation. And remove as much clothing as practical and loosen any restrictive garments. Then, if alert and oriented, give small sips of cool liquids to the patient. Now, what you're going to do, because if this patient is having some form of mild hypovolemia, they may be having dizziness. The way to do this is you have to lie down the patient and elevate the legs, and it's because they are overheat. They have a lot of heat also. You need to provide wet towels to this patient, placed in the neck, in the abdominal area or the groin area. The water that we're going to use, this one is not, it's just a normal tepid water temperature and not ice cold water. Or now you can establish IV access for this patient, like lactate ringers, normal saline. Okay, replacement of 1 to 2 liters of crystalloids or normal saline at 500 ml per hour is often adequate in reaching the intravascular volume of this patient. Now, external cooling measures are usually not required for this patient. Okay. However, if this, right, for heat stroke patients, monitor and record vital signs and level of consciousness. Now, removing the patient. Yes.
Can you talk for a while? We have one
Alright.
more question regarding heat absorption. I suggest all participant, I request participant to please check your chat box There's a question. What steps should be taken if you find someone is suffering from a heat exhaustion? A, move to cool, shady place, remove using clothing, fan vigorously, spray with the water, have a worker drink water, elevate legs, all of the above. Can you please answer, participants? Can you see the question in the chat box?
CG is not yet there. The question, CG.
Is there somebody's answer?
No, it's not there yet, Mr. CG.
I already placed.
Try to copy paste again.
Can you see now? I did second time.
No. Just make sure you send for everyone, Mr. CG.
Okay, no problem. The question was, if everybody can answer, what step should be taken if you find someone is suffering from a heat exhaustion? Answer 1, A is move to cool, shady area. Answer B, remove or loosen the clothing. Question C, fan vigorously. D, spray with water, place wet clothing on body, have worker drink plenty of water, elevate legs. And G, all of the above. You're getting answer G, all of the above. Yeah,
Yes, the answer there is all of the above.
all of the above.
Okay.
Okay, Minsky, you can continue.
All right. To continue, sorry, open here. To continue the management for patient in heat stroke. Now, our aim here is to rapidly reduce the core temperature to approximately 39 degrees centigrade on patient with heat stroke. Now we have to begin after cooling. In a hospital setting, it would be difficult if we have a cold water immersion, or you can use your body bag to provide that one. If you have the materials. If not, you can bring the patient inside the ambulance, pull on the AC. You can remove all the clothing, or you can splash the patient with cold water or misting with cold water. You can provide ice packs to this patient. You place the ice packs in the groin, in the axilla, and the neck of the patient. Now, if the patient is shivering, you may discontinue the cooling process. And while doing this, you can transport the patient right away. Then don't forget to monitor the record and vital signs of this patient and the level of consciousness as well. Now, if the patient, the vital signs of the patient has, if the patient has altered mental status, you might also get the RBS of this patient. If the RBS is below 60, then you may administer 50% dextrose to the patient over 2 minutes. Repeat in 5 minutes if there is no improvement in the mental status of this patient. Okay, and then transportation without delay to any emergency health facility. Now we go back to our case scenario here. On a hot summer day with relative humidity outside, EMS were dispatched to a shutdown area where a person suddenly collapsed. Upon arrival, responders found a 40-year-old male laying on the ground with a GCS score of 12, blood pressure of 185/81, pulse of 104, respiratory rate of 16, pulse oximetry of 98, on room air and a temperature of 41 degrees centigrade. Now, first question, what is your assessment of the above scenario given the symptoms and signs and symptoms? Anybody can answer? Can you answer in the chat box?
Participant, please unmute your mic and you can answer.
Or check that.
Anybody? We appreciate everybody to participate. Case scenario question. Anybody from Missile side can answer? The question is, what is your assessment of above scenario? Chat box, we got a response from the chat box. Heat stroke. Most of them are answered heat stroke. Minsky, we're receiving the answer in the chat
Okay.
box is a heat stroke.
Yes,
Is it
based
correct
on
answer?
yes, based on the presenting sign of symptoms, this is a classic. This is heat stroke.
Okay.
Okay. All right.
Okay.
The second
Why?
question. Okay, CG.
Okay.
All right. Second question that we have, what is your primary aim or goal in managing this kind of patient? For the heat stroke patient, what is your primary aim and goal?
Participant, please answer. The presenter is asking, what is the prime aim or goal to manage this kind of cases? You can unmute your mic and you can answer it. Anybody from Raslafan, please answer. We are getting a mixed answer in the chat box. Cool down body temperature, lower the body temperature, decrease, cooling the patient, lower the temperature, lower the body temperature to 39 degrees Celsius, active cooling, transport to the hospital, cooling the body temperature. Majority answer is cooling down the body temperature. There are some answer, move patient to the cool environment. There are somebody's answered lowering the core body temperature.
Yes, the primary aim or goal in managing this heat stroke patient. The primary aim is to aggressively lower the temperature of this patient below 40 degrees centigrade. So in that way, because at temperatures of 40 and above or above 40, there'll be increase of cellular brain damage of this patient if you have to remain this patient in this kind of temperature. And another thing aside from vigorously cooling the patient to below 40 is to prevent and reduce damage to your brain and vital organs as well. Okay.
Okay.
Question number 3. How do you manage this patient? I think we have just discussed it earlier, of how to manage the patient.
A participant, please unmute your mic and can you answer? How do you manage this patient in the pre-hospital setting? Anybody from Dukan? Anybody can answer.
Monitor vital
Notice.
signs.
Yeah, that's one.
Oh, yeah. Okay. Thank you,
Anybody
Ria.
can just butt in on this one. You don't have to answer all, but yeah, you can give just one answer if you need, and another guy one answer.
Okay, we'll go ahead. Dukan, one answer. Okay. Then Raslafan, one answer, and Misaid, one answer. Is it okay?
Yeah.
Yeah.
Anything?
Anybody from Raslafan, one answer. Unmute your mic. Okay. Misaid, from anybody, Misaid, you want to answer? We are receiving some mixed response from the participants. They responded IV fluids transfer, body bag, water ice, IV transport, IV fluids, protect ABC, active cooling, dehydrate the patient to the hospital, active cooling, shifting the patient to the cool area, fan, shower, IV fluids, monitoring, IV fluids, check BSL, exposing the patient, move the patient to the cool area, and IV fluids. Minsky, we received the more response from the IV fluids and move the patient to the cool area. What is your answer?
Yeah. Well, all of it combined, CJ. The management of the patient is, as we said earlier, okay, you have to monitor the vital signs of this patient, check
Okay.
the level of consciousness, aggressively lower the temperature by, if you have cold water immersion, if you can do that.
Okay.
You can also, first you have to remove the patient from the hot environment to a cooler place. Okay.
Okay.
Yes, you may give also IV fluids to this patient, but you have to limit the IV fluids, only 200 ml boluses to support for any form of hypovolemia or dehydration in this patient. Okay, and with the vital signs also, you have to check if their BS is low, then you have to give dextrose 50% until the mental status comes back from this patient.
Okay.
All right. So
Okay.
to continue,
Yeah, continue. Presentation.
just the summary already here. The method and aggressive cooling in the field depends on the type of health emergency encountered. Regardless of the underlying cause, removal from the heat and rapid cooling is critical because the extent of morbidity is directly related to both the degree and duration of hyperthermia. All treatment in the field is first directed to stabilization of the patient's ABC before proceeding to specific therapy. Now, these are my references here, and that's all. I think I have gone through too fast. That's why I don't understand what I'm talking.
Don't worry, you did very well. Now our floor is open for a question and answer section. The participant, if you have any questions, please write down on the chat box, or you can directly ask to the presenter. Unmute your mic and you can raise your questions to the presenter, please. Anybody have any questions? This is the time for a question and answer section.
Any questions or any addition to the topic of today will be greatly appreciated.
Anybody from Rasalafan? We can outside from anybody from Qatar at present. You have any doubt? You can ask to our presenter, Mr. Minsky.
Mr. CG, I think there's a question in the chat box that was not answered earlier. So please have a look at the chat box and so we can answer the question by the participant.
Yeah. There is a question in the chat box. Which of the following is not a common symptom of heat exhaustion? That question we was asked previously.
Yeah, it was not answered earlier.
Yeah, yeah.
Come again?
We appreciate a chat box means you can check. Which of the following is not the common symptom of heat exhaustion? Clammy skin, extreme thirst, dry mouth, nausea, headache, rapid breathing, and diarrhea. We got a mix of answers. Most of them are answered C, and some of them are answered A, but majority of them answered C. What is the right answer?
Well, I think CG is dry mouth. Usually, sometimes people with suffering from heat exhaustion, some of these people have diarrhea. Actually, have
Correct.
diarrhea.
Okay, okay. Both the diarrhea and
Mr.
the
CG,
question is
I
not
have
common.
question. Is it possible?
Okay, please answer.
No, I have question.
Your question. Okay,
Okay.
okay.
Mr.
ahead.
Minsky, yeah, thank you for your great explanation in this topic. The first question, is there any like procedure or guidance regarding avoiding the cooling rapidly or overcooling? Like for the example, how many minutes that we have to check the patient to avoid this one will be happen like that? Is it only just waiting patient up to there is a sign of shivering like that, or there is certain method or certain time that we have to check the patient before the patient fall to this kind of situation?
And to
Thank you.
shivering. Okay.
Yeah.
Well, the patient in heat stroke will shiver if the patient is immersed in cold water for too long. Usually, if they're immersed in about 30 to 40 minutes in cold water before transporting to this patient. There was a study also that in normal persons, they are immersed in cold water. They were immersed in cold water, and the study found out that not until they were there for 30 to 40 minutes that these people had sudden symptoms of started to shiver. Now, patient with heat stroke, I don't think there must be a problem if you just immerse this patient within 10 to 15 minutes before transporting this patient to the hospital. However, if you have a capacity, you have the capability of measuring the temperature, the rectal temperature of this patient using a electronic rectal thermometer, then even though you are immersing this patient into the cold water, you'll be able to assess, or you'll be able to take the temperature every 4 minutes. And when the temperature goes below 40 or 39 or 30.8, then you can remove the patient from there and transport to the hospital. Do you is that the answer that you're looking for, or you want any more clarification?
Yeah. That's the thing, because we have the thermometer now in our unit, right? So at least we can use that thermometer to check the patient in certain timing like that, rather than we just waiting the patient. There is sign of symptom like shivering begins like that. That's the time we have to stop the cooling process.
Yeah.
Thank you.
Actually, the correct way, is to monitor the temperature, the core temperature of the patient every 4 minutes.
Every 4 minutes. Okay.
Every
Okay.
4 minutes, yes. Yeah.
The other thing, Minsky,
Yes.
is it practically if we, for the example, because we have the IV bag, right? The one we put it in the small fridge. That
yeah.
one is more helpful, or just we just use it the one in the responder bag? Which one
What?
is more preferable actually? The
Which
one
one?
inside the fridge to make it cooling this one, or the one in the our responder bag?
The IVF, you mean?
Yeah. The IV fluid, the bags.
IV fluids.
Yeah.
Yeah, well, actually, if you'll be able to cold, what do you call this one? Yeah, cold IV fluids. If you can give a cold IV fluids to the patient, that would be very helpful to the patient, because the fluids will go directly to the to the visceral area and cool the patient rapidly. However, anyway, the temperature that we have in our what you call in our refrigeration is not maybe just around 35 or 36, right? The temperature, so it will not cause shivering to this patient because you're giving it to the patient who have heat stroke.
Yeah.
And yes, it's
At
more
least we have
preferable if you have that
these
one.
facilities for that one.
However, Ria, I don't know if
Yeah.
our guideline, it's in our guidelines also. I'm not really sure
Okay.
about it also.
Okay. Okay. Thank you, man. Thank you.
Yeah, thank you.
Thank you, Ria, for your question. And I think Mr. Minsky's answered your question. Anybody else? We have plenty of time, more than 20 minutes. We are requesting participant, if you have any questions, please.
And I
Thank you.
have one question, Mr. Moderator.
Please go ahead, Mr. Rahman.
Yeah. Mr. Miski, congratulations for nice presentation. I just would like to ask, you mentioned about giving the ice bath. So what will happen if the patient somehow is shivering? So anything that you can do basically? Thank
Well,
you.
If in cold water immersion, if the person starts shivering, you can just remove the patient from immersion. But if the shivering is too severe, when you remove the patient that's severe or is having seizures already, then you can give diazepam injection to this patient, or any other benzodiazepine. Now, I think only the paramedics can do that in our region in Qatar Energy. But yes, you can give injection diazepam of, I think, 5 milligrams IV.
All right. Thank you so much for the
Okay.
answer. It is very interesting, the update. Thank you.
Thank you, Aman, for your question, and thank you, Aman. I think Minsky's answered your question. Anybody else?
CG,
Yes, please. Who is this?
Emil.
Emil, please go ahead.
All right. Our whenever we deal with heat exhaustion, heat stroke, for that matter, what do we have? What resources do we have in our ambulance? Okay, our priority is always ABC, right? Now, when we get that stable, ABC stable, now we try to cool down the patient, right? Now, what do you have in your ambulances? Normally, during this season or any other season, in my side, we have this cool box with water in them, not necessarily ice. We have that cooling thing from the freezer, that one. So how do we cool the patient? What tools do we have? So this is one tool that we have. This cool box that we have has water in them, right? Many people
Yes.
would know it. We drink it sometimes, no? We're on standby in a heat environment. So what we can do, we can remove everything, all the things inside the cool box. Open the water, put it there. You can cut your blue sheets. You can cut your blue sheets and use that one in the water. And then you have something to use for cooling the patient after you do the ABCs. You put it in the head, you put it in the groin, and the axilla, and everything. Now, once the patient, and then we try to monitor the temperature and also the mental status of the patient while we are cooling down the patient. Now, if the patient starts shivering, the only thing we can do is dry the patient, dry him up. Try to dry him up with the towel that we have in the ambulance, or if you have dry sheets, the bed sheet that you have, dry him up. And that's the only thing we can do, and just keep monitoring the patient, continue that procedure until you reach the hospital. If you have time to initiate fluids, then do so. But our main temperature is to cool down this patient without disregarding the ABCs. Yeah, that's the tool we have, and then we can make use of it.
Yes, thank you, Mr. Emil, for your suggestion and your comments regarding the presentation. We appreciate that. Participants, we have 20 more minutes.
CG, there is 2 questions in the chat box, CG, from Mr. Oliver and from Mr. Boris. You can check it.
Okay. Mr. Oliver is asking which IV fluid is more beneficial to the patient with the heat-related illness, normal saline or ringer lactate? Minsky,
In heat-related illnesses, lactate ringers is the preferred choice. It's because lactate ringers also, however, giving this to the patient will not be so aggressive. As in the management, we have to give 500 ml per hour to this patient. Because the reason for this one, because lactate ringers will remain in the intravascular compartment longer, remain in the intravascular compartment longer, then there will be an increase in blood volume, supporting intravascular peripheral circulation or visceral circulation. So Solmar saline is most effective in this area. Not
You
unless
prefer
if
more
in a
answer is
pre-hospital
normal
setting,
saline.
that's
Yeah,
right.
pre-hospital setting normal saline, yes. This another question is from Mr. Boris. Does checking the rectal temperature is appropriate in Qatar? Appropriate is in Qatar out of hospital setting.
Can you repeat the question? Can you louder, please?
Does checking rectal temperature is appropriate is in Qatar out of hospital setting? He's asking is it appropriate to check the rectal temperature of the patient?
Yeah, although rectal temperature is the will provide the will provide the true temperature of the patient, but of course we cannot do it here in Qatar, especially in the outside environment, especially in the in the field.
Yeah.
So you have to do what you have, or you have to do what can you do with this patient actually. You can do the other the tympanic thermometer, the other oral thermometer, but this is not really precise in measuring the internal body temperature of the patient. But of course, you have to provide dignity. If you can do it inside the ambulance, if the patient is conscious enough to I will allow you to do it, and you have a rectal thermometer, then you can do that. But if outside the field, I think it's not. I think it's not possible.
Okay. Mr. Boris, you got the answer? Okay. Anybody else? Copy. Okay. Any questions? Yeah, please write down the chat box. I'll try to read it out. We have 15 minutes more to go. Anybody from outside the Qatar Energy, Red Crescent or Qatar Steel, Qatar Gas, you have any questions? Mr. J is right down the chat box, managing the patient. Strip the patient, remove the clothes, spray, fan, ice cold, the form of active cooling.
Okay. Can you repeat? Keep it louder, CJ, please.
This J write out on the chat box. Strip, spray, fan, ice cold, and the form of active cooling. You can read out on the, everybody can read out in the chat box.
For him to answer.
Yeah. He answered, how to manage the patient in the heat exhaustion or heat stroke. Minsky, I have a question. The patient has in a heat stroke or heat exhaustion. Which vital organ is the most affected? Is it brain or heart or kidney? Then what is the role of sodium in the role of the heat exhaustion?
You're talking about heat exhaustion or heat
Stroke.
heat stroke in general.
Yeah.
Heat stroke.
Yeah.
Okay. Well, the thing with heat stroke, because there is severe hypovolemia, CG.
Okay.
With decreased circulating blood volume
Okay.
to the cerebral circulation.
Okay.
There is a multi-organ system failure, but the most important, it will affect the brain, the kidney, and the liver.
Okay.
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 So
Brain is the most
yeah,
affected, right?
brain is the most, then followed by the kidney and the liver.
Okay. Okay. Thank you. Thank you, Ms. Minsky.
Alright.
Any questions? Any question regarding the presentation?
Minsky, let's start a conversation here. I've been reading all the comments regarding, can you hear me?
Yes.
Yes,
Yes.
Good morning. Thank you, Minsky. Now we've been discussing several things related to the management. I got my attention regarding two things actually. The practicality of the management and in particular the shivering cold and the temperature. Because first and foremost, if we're talking about shivering, to avoid shivering, what is the temperature most likely the patient will start to shiver? Do we
around
need
35 degrees centigrade.
exactly? That's the point. It's around 35. So I believe the question in this is also addressing the question of Priya Budi, whether when do we start transferring? Remember, if this is a heat stroke, this is a load and go patient. This is a load and go. We don't have the time and the luxury to start putting him in a cold ice pack, submerge him in cold water, so that the temperature will go down. And we will, then the only time we will stop is when the person stops shivering. Whether you have available temperature machine or not. Right? Yes, having said, when the patient starts shivering, it's way too low. It's 35. Maybe some literature is also saying 34. So this is. Do you agree with me that this patient, since this is a heat stroke, it's a priority one. We need to immediately load and go the patient, transfer and provide active cooling measure inside the ambulance, and don't waste any time at the scene. And this is also in relation with Emil's point. What are the resources, the one that we have inside the ambulance? So utilize all those resources that we have in order to initiate active cooling. That's the only thing we can do practically on the ground. So because I was just listening to them, why we are so concerned about the temperature, why we're so concerned about shivering. Right? So same thing. Now I have a comment from Mr. Saipo, sudden rush of cooling causing shivering. Also, when we cause shivering, it will start increasing demand on the temperature or body temperature. So all the answers are correct. It's just a matter of applying it in a practical scenario. Those hypothetical notes, they are evidence-based. However, I believe what we should be focusing right now is what we can do at the back of the ambulance or in our current setting. If you will go back to your scenario, right? So what you can do? So well, I guess we could explore the management or the question from this topics. Assessment first, we need to identify whether it's a heat stroke or heat exhaustion. Then let's manage the patient based on the current resources that we have and what is the goal. So I'm just initiating a discussion here. So maybe you can go back on your scenario, then from there we'll start the discussion. Since we have time, nobody, I think some of them are just happy to participate by chatting, putting their notes on the chat box. But I would love to hear from someone who's discussing or communicating with you outside Ria Budi and Mr. Aman, who are member of the SPC. So let's move on. Go ahead.
Yeah. Anybody from other than Aman and Ria? Any question? And Amy, thank you, Emil, also raised wonderful discussion. Please, any question, any comments?
Minsky, can you go back in your scenario so we can just review for the last 7 minutes?
Hold on.
Thank you. Okay, so now this is a good discussion or a good topic for discussion. Let's look at the signs and symptoms. Upon arrival, the responder found a 40-year-old male. So that's given. It's a male patient. GCS of 12. Okay, let's discuss about GCS of 12. Most likely based on differentiating between heat exhaustion and heat stroke. Altered level of consciousness. Does it happen to heat exhaustion, to heat stroke only, or does it happen to heat exhaustion? Perhaps we'd like to ask question. Just ask question from our participant.
Participants, please answer your question. What Jay is asking.
I heard Enrico, Mr. Enrico, please. With GCS score of 12, so initially you only receive information that he has a GCS of 12. So do you suspect heat exhaustion or heat stroke, or maybe both?
Can be both.
Can be both?
Yes.
Rick, is that you? Mr. Jeffrey, I'm looking at your video. Pardon me, Mr. Jeffrey Antonio. Thank you very much, sir. I just want to ask.
Yes, I'm so sorry. I have a patient right now with a heat stress, actually.
Okay,
I'm attending right now. I'm
so
sorry.
what's the GCS of the patient?
Sorry?
What is the GCS of your patient?
Yes, GCS 15, but he's having cramping.
Okay.
So it's a warning signs, actually. They brought him here. So yeah, I'm treating him right now. So I just have to observe him.
Okay. Thank you, Mr. Jeff.
I'm so sorry for that.
Okay, then. So you are treating him, or can you spare 1 minute, or you're free now, or what?
No, I'm fine.
Okay, then please tell us, since this is a direct experience
I'm
right
free.
now.
Just observing him right now.
Okay, what is his GCS? You mentioned about 15. So what are you suspecting? Is it heat exhaustion or heat stroke?
Sorry?
What is your possible or probable diagnosis right now? Is it a heat
It's more of a
exhaustion or
heat
stroke?
stress, or like, having heat cramps. Yeah.
So it's still
It's-
within the heat cramps and heat exhaustion stage, correct? Excellent. Can you tell us the blood pressure then?
Sorry?
What is the patient's blood pressure?
The blood pressure, actually, it's stable. I'm taking a 130/80 because they brought him already, like he rested on the site cooling areas. So they just brought him here for stabilization, more stabilization and observation. So at that time, in the cooling areas, the BP was quite high, 140/110.
You're muted, Mr.
110 and heart 115. And the saturation is 98 and
Excellent.
temperature of 37.3.
Yes, so this is a common one because the reason why I want to emphasize on blood pressure, Mr. Jeffrey, why do you think in the initial the patient has a high blood pressure?
So I was thinking because of one thing is he's like so sort of anxious. He's people are like around him, a lot of people around him. It's a bit anxious, and
Mhm.
because of the effect of the the temperature getting high. So yeah, then
So he
yeah,
received.
obviously
did-
if you have
did
that
he receive-
that problem, it will increase your vital signs, BP, cardiac rate. Especially if you're having this
Yes, I agree. Totally agree,
signs of electrolyte imbalance,
Mr.
you're
Jeff.
already having this cramping.
Mhm. You know, Mr. Jeffrey, the common issue here, especially with patient with blood pressure and heat exhaustion, sometimes if the patient will come with us or come to us, or even in the hospital, or even on the time that we notice, we will have a high blood pressure. What is the cause of high blood pressure? Patient lost a lot of fluids. It's a form of compensatory mechanism. The patient is, yes, exactly, Mr. Berwin. The patient is compensating because he has lost a lot of fluids. So definitely don't be surprised that the patient's blood pressure is high. But the reason why I'm telling this is commonly, how do we perceive this as an EMS or medical provider? We will say, no, we will only limit the fluids because his blood pressure is high. We don't want to give too much fluid. This is the common issues that I always encounter. That's why I'm emphasizing this. It's a compensatory mechanism. Do not withhold any fluids. The high blood pressure is secondary to the compensation of the body. So it's a good practical. Thank you, Mr.
Antonio.
Jeffrey.
Antonio.
So
Yeah.
it's a practical application, actually.
Thank you as well. Thank you.
Everybody's info. So do not withhold any IV fluids for any heat-related illnesses from heat cramps, heat exhaustion, or because automatically the blood pressure will be high initially, and it's a form of compensatory mechanism. Thank you very much, Mr. Jeff. I appreciate that one. Thank you for your time as well. What was the temperature of the patient?
Temperature now it's like at 36.5. Yeah.
So he's not shivering, huh?
No.
Okay then. So we're okay. We're not still shivering at the end at the temperature of 37.5. So well, it's 11 o'clock. I'm turning it over, Mr. CG.
Okay. Thank you, Mr. J. Thank you, Mr. Jeffrey, for your answers. And Mr. Minsky, we reach the end of today's presentation. And thank you very much, Mr. Minsky, for your wonderful presentation, and all participants. We hope that you learned something valuable for this event. And thank you, everyone, for having this CPD section. We have a great lineup of speakers. We have planned for a number of activities this year. And our next presentation will be after 2 weeks. It will be on 24th of July. Our next presentation is the title is Hypertensive Crisis.
Screenshot.
I am the one. Screenshot.
Minsky, can you please unshare your slides so we can see all participants as a whole?
Okay. Mr. Aman, please take a screenshot.
Say cheese.
Yes.
Sure.
Yeah. Participant, our next CPD is in 24th July, after a couple of weeks. The topic is a hypertensive crisis, is very important, presented by me. I encourage everybody to attend to that.
It's a conflict of interest, Mr. CG. You're promoting your topic. Ladies and gentlemen, thank you for attending. Before we will let you go, please a round of applause to Mr. Minsky Concepcion for his wonderful presentation. Thank you, Mr. Minsky. Thank you.
Minsky, Minsky, stay on.
Thank you very guys for
Yeah.
putting up with me for today's presentation.
Thank you very much.
Okay, so until then, see you all. Thank you. Next
All right.
week, after 2 weeks.
Yeah, next week.
SPC, please stay. Mr. Minsky, please stay.
Minsky also.
Yeah.
Thank you, Minsky. Thank you.
Thank you, Mil. Thank you.
Bye.
Minsky, Emil.
Anel. Thank you, Chris. Thank you, Berwin, Oliver. Too many, Marcidine. Thank you. Timbak, Ali, Joel, Soumya, Marcidine. From our Red Crescent, guys. Thank you, guys. Askan. Oh, Mr. Adskan. Thank you. Katargas. Call out, shout out. Thank you from our Red Crescent, from our Qatar Petrochemical, Qatar Fertilizer, from our MOY. Thank you, guys. From our own, of course, healthcare department, nursing staff, and EMS personnel. Thank you, guys. Thank you. From the OH team as well. Thank you. Everybody, Paul, Mr. Paul. So you can all leave now. See you again after 2 weeks. Thank you, Ate Ruby. Marvin, thank you. I was wanting to call Marvin. Maybe next time, Marvin. SPC, please help out. Some of them are still. Sabor, thank you. Thank you, Anel. Thank you. Thank you. Honey, thank you. Miss Linda, thank you, Linda. If you can hear me, you may have a patient right now. Thank you. Uyad, thank you. Ibrahim, thank you. You can all go out now, except for the SPC. Karen, welcome back. Karen Kate, shout out, thank you. Faisal. Okay, hi, Mr. Faisal, thank you. Nice to see your name again, Mr. Faisal. Ajay, thank you, Ajay. Come on, guys. Ria, help out, Ria. It's still doing it. I'm removing some of them.
Remove it one by one.
Yes, yes, me too as well.